Good afternoon. This is Dr. John Bennett, televising from Miami. Today we have the pleasure of doing a hangout in the Augmented Reality in Medicine channel for internetmedicine.com. We have Henrique Lambert, MD, an orthopedic spine surgeon from southern Brazil. He's going to talk about augmented reality in spinal surgery, a very interesting topic. And we're going to first introduce the panelists and then we'll turn it over to Henrique. Good day, Bruno.
Hi, good afternoon, everybody. It's nice to be here again.
Okay, Bruno, could you just tell about where you're from and what you do and stuff?
Oh, of course, I'm sorry. My name is Bruno Gobato. I'm an orthopedic surgeon from South Brazil. I work especially with shoulder and elbow cases, and I'm also a 3D printer enthusiast.
Very good. Welcome, Bruno. Bruno introduced me to Henrique. I'm sorry, Francesca. Lady, you should have been first, but go ahead. Hi, Francesca. You're muted. You're muted, Francesca. That's a common mistake. Whoa, you're mute. It's a common mistake. People talk and mute. Okay.
Yes. I'm sorry. Good afternoon. I'm Francesca Ochia. I'm a 50th medical student from Bucharest, Romania, and I'm also the president of the Walter Denty Neurosurgical Club here in Bucharest. And I am really excited to be here. So thank you.
Welcome, Francesca, and my main man, Simon.
Hello, everyone. It's great to be here again. I'm in Tokyo, Japan. It's 3 a.m. I'm glad to be up this hour. I'm a medical student interested in this presentation very much. Thank you very much.
Welcome, Simon. Okay, Henrique, welcome, and away you go.
Okay, thank you, John. My name is Henrique. I'm an orthopedic spine surgeon in South Brazil at Santa Catarina. We'll start doing this presentation, so let me share my screen with you. A second. Here. So,
okay, it's fine.
So, can you see the screen?
Yes, we can.
So today we're talking about mixed reality applications in the medical field, especially in orthopedic spine surgery. That's what I'm doing every day in my life. So I'm Dr. Henrique Lambert. I'm a fellow spine surgeon in Hospital Pequeno Príncipe in Hospital Evangélico in Curitiba, Brazil, in 2010. This was a hospital in spine surgery, pediatric spine surgery, and trauma and degenerative spine surgery at Hospital Evangélico. I'm a Brazilian Spine Society member. I work at IOT Jaraguá. It's a clinic in South Brazil, in Santa Catarina, and work at two main hospitals, São José and Jaraguá, that are in the city. So the first thing I'll be talking here is some of the definitions that are moving fast, and the first thing I would to talk is about what is a virtual reality. So virtual reality is when you're closed, you don't see the environment around you. You're fully immersive on a 3D room. The evolution from the virtual reality began with the augmented reality.
Excuse me, Henrique, your slides aren't changing.
What?
Your slide is not changing. It's still on the first slide.
Oh, yeah.
There you go. Okay, there you
now,
go.
Can you see?
Yes, yes.
So I will stay with the open program here. So virtual reality is when you stay in a virtual room, so you don't have contact with the outside world, with the real world. In the next, this evolved to the augmented reality, where you use a device like a cell phone or a tablet to render 3D objects at a screen, and you have a perception of the real reality around you. And now the latest innovation in the field is the mixed reality. where you interact around with your world using 3D holograms rendered by a glass, like the Microsoft HoloLens, that is the most new and advanced hardware available right now. So to start, say why we are doing this kind of research, and I think is not maybe the reality of spine surgery around the world, but in Brazil, what we mainly do is surgeries with C-arm, only C-arm registration. In other places of the world, you have available the O-arm. That's when you can take a CT scan inside the operating room. Also, there is the intraoperative neurophysiological monitoring. That is when you have a neurological monitoring of the motor state of the patients. Here in Brazil, we have this in only few private patients. Is not available for every surgery that we do in spine surgery. And the neuronavigation, that is a procedure where you use infrared guiding for anatomy check and screw placement is not possible in every time. You can use only in private patients in few and not much patients. So it's almost possible to use too, because you need to do a setup of the surgery in the operation room. You can't do surgical planning at your home. You need to do that in the surgery room, so it will take more time, and that is not possible to do here at the moment. So now I would like to show what is our what we do at the moment. So we use the data collected from CT scan. We then segment and extract STL as a model with 3D softwares like Osiris, Ibesalus, 3D Slicer. There is Mimics also there, but is very expensive to a surgeon have at home. So maybe an institution can buy and use, but it's very expensive to use this kind of software. These options I show here, they are free. After we segment and extract the models from the CT scan, we can do a surgical planning at a 3D CAD software like Rhino 3D, Blender. Some of the segmentation and STL extraction softwares have some surgical planning CAD, but not many. And after that, we choose to 3D print that or to do a visualization in a mixed reality fashion with the Microsoft HoloLens. So let me show you here. To show you what is our work, here is an example, a video I posted where I will show this fluxogram I showed you earlier. So here we see a surgical planning. This is the CT scan and the implant positioning that we do before the surgery. And here as an example of the mesh that is extracted from the CT scan. Is a real size and scale mesh. It has a lot of details. After that, I extract the regions of interest that I will be using in my surgery. In this case, is a scoliotic patient. And here I have a posterior arc renderization. And you can see how I will take back here because this is the most important figure here. This is the actual vision that I have in a surgery room. Here in the surgery room, you can see the mesh, the hologram placed over the surgical field. And actually I do a mirrored experience. So I use the hologram rendered as a 3D printed model. So I use as a reference comparing the anatomy of the patients with the model we created. Okay. Here's some post-op images from the CT showing how the implants were in a good position, the final result in the X-ray, and the CT reconstruction showing we have a good outcome in these patients. What I can tell you after this first case we did is that I had less use of fluoroscopic of the C-arm, so I'm having less radiation exposure. And in some of the cases, I had a faster implantation of, I had a fast instrumentation of the spine. So it was a lower time of surgery, but I need to record those data and do an article, a medical article to prove that. So I have some few cases at the moment. So I will take some time to record all the data and do this article. The hardware we use is the Microsoft HoloLens. It was developed by a Brazilian guy also called Alex Kipman. And the HoloLens use 4 or 6 cameras that do extraction of positional data and process this in a holographic processor. This is a new hardware is under development. I got one of these development kits. It's expensive. It's $3,000, but if you think this on health costs is very cheaper compared to health alternatives. I'm not the only one using this technology. Duke University has a lot of experiments with HoloLens. If you look at the internet, you're going to see other doctors and engineers working, especially in education field and in surgical field. So here, in this use of the technology, I found the benefits of the use of HoloLens till now. That is the anatomy visualization through meshes and models. You can also look at exams at the operation room. There's also the possibility to broadcast a surgery for other surgeons with your field of view. That's with an awesome camera. You can do simulation procedures, education. On surgery, you have no infection risk because you don't need any other hardware, and you don't put hardware in contact with the patient. I'm currently using it for open surgery, especially in deformity. The limitations of the hardware is the field of view. There is a small field of view. I think that's not a limitation because in surgery room you need space so you can work without pollution. I find very difficult today to do overlapping holograms because the hardware doesn't let you overlap the holograms until now. You don't have you need some more specific identification of anatomy that's not available right now. Sometimes if you you can have neck pain when you're doing a surgery, if something in your head, if you spread, if you're you can have headache too. I can use that for about 2-3 hours without having neck pain. But if I stay looking through the lenses and the surgical field, sometimes I get neck pain after the surgery. The hardware was designed for a 2 meters interaction. So when you interact with holograms too close to you, you get some difficult to see details. Some people have more difficult. In my case, I don't have difficult to work with near holograms. There's not an outside accessory tracking, so that's why it is so hard to overlap holograms on surgical field. Actually using a tracking from inside the device, inside the glass. I think for a more precision procedure, you would need outside tracking. And at the moment, we can't use that for minimal invasive surgery. What we do is most likely a 3D printing model. I can look at the anatomy, but I can't do the overlapping at the moment. I think that will be available in a near future. So here I have some videos of surgery room. Let me play here. In this case, we have a hologram of the patients. This is my actual field of view. You're gonna notice that sometimes I'm not looking at the surgical field because I'm not looking through the glass. I'm looking below the glass lenses, and there's an awesome camera, and you can do a very good registration of this surgery. I do almost normal steps of spine surgery. Let me show something here. The hologram is right here, but you see, I'm looking through at the incision, but the camera is not recording. When you want to record, I think it's better when your assistant is filming. So here I'm helping a neurosurgeon doctor to do a posterior decompressing, cervical posterior decompressing, and here we have a very good registration of the surgery. To the moment, I haven't seen any camera doing this kind of registration, this so beautiful registration of the procedure. I think for a medical congress or to broadcast surgeries is an excellent device. You have also the possibility of seeing your exams at the operating room. So here we have a connection, a Wi-Fi connection, where I can get all patient data and exams and look in the operative room in the OR without using the fluoroscope or other things. Here I have one of my surgery records showing how I put the hologram on when I'm doing a surgery. This is an early development video, so I was experiencing this 3D shader, is a wireframe shader, where that's not good for registering, but for surgery is very good. It's important to tell that the recording of the camera is a lot worse from what you see in the through the lenses of the HoloLens. the image is so clear, and the position is very better than what is registered in the device camera. Okay, so this is a representation of the hologram at the operating room. Let me show. There are other possibilities for using at orthopedics at the moment. I'm experienced for my colleagues' procedures. Here we have a 3D model in the screen, computer screen, and a hologram of the surgery showing the pathology here and the plan for surgery. Here is a hip arthroplasty. So you can see the details of what I see here and at the computer screen are very excellent, are very good. Also here is an application for Dr. Bruno Sgobato surgery, is a malunion of the clavicle where we have some deformity. His is the correction plane. We're going to use that on Monday on a surgery on Dr. Bruno's surgery. I will show you the videos if you want later. Just ask. So here you can have an excellent visualization. In this case, I will try to overlap over the patient's anatomy. So if you look, is a awesome detail image. And now there are some CAD programs available for HoloLens use also. This is a CAD program that runs inside HoloLens where you can do your plan, surgical plan. So here I'm doing X-ray vision of the model. This is one of my patients' models. You can see here a fluoroscopic view of the model, where here are shown the spine canal and the pedicle. You can see the pedicle structure here, so you can do instrumentation. And at the moment, I'm doing the surgical planning at this software that is now available for HoloLens use. Here at the corner of the screen is a printed model of the same patients, and they're a lot equal. They have a good definition of the details of the mesh. So, do you have any questions? Do you want to ask something?
Okay. Does anybody have any questions or comments? Well, I guess we'll start with you, Bruno.
Yes, John. What we are very excited to show here in your blog, in your webcast, that those technologies are available for everyone. We are used to see technologies that are only available for big hospitals, for big universities with big labs. So me and Dr. Henrique are two private practice doctors making different things, you know, that are available for everyone. So everyone who wants to learn, who wants to use mixed reality, who wants to use 3D printing, can use in their office, can use in every office in the world. We are from a third world country doing this. So I really think everyone in the world can do something like that, and can do in your office, in your hospital, can do in your university as well. That's what I think is the most important thing would like to show here, you know.
Yes, you know, Bruno, you and Henrique have the technology you want to show, and we want to also show the technology of this platform of Hangouts to allow people like you, Henrique, Simon, Francesca, to come together from around the world to learn. and we hope that you guys continue to, because it sounds like you guys will be doing a lot of educating, and this platform is perfect for you to reach surgeons and students around the world to teach, because it seems like there'll be a lot of interest.
That's
I can
correct,
say
John.
that you can talk, Bruno.
No, Ricky, it's your call.
I think this technology will be awesome for students, for fellows, for surgeons that are started working, that don't that aren't in a reference surgical university. So everyone now have access for a brilliant piece of equipment that will help for their learning and for their first surgeries. Okay.
Well, excuse me, I neglected to send Victor Hugo a link to come in, but I want to introduce a neurosurgeon from Mexico City. He's a well-known anatomist, and he's working now, Henrique and Bruno, on the neuroanatomy of the spine. Hello, Victor.
Hi, how are you?
Yeah, Henrique just did an excellent presentation of what he's doing in the OR with augmented reality. And certainly you would have an interest because you're working on spinal anatomy right now, neuroanatomy.
Yeah, specifically in the surgical anatomy of the spinal cord. I am doing some research about the arteries and veins of the spinal cord.
Okay.
Until now, I have almost 150 spinal cords injected with the arteries and the veins. And this is an interesting researching because we can see several interesting things about the surgical anatomy.
You know, one quick question I'd like to ask Henrique and Bruno is that it helps you with visualizing the bony anatomy. Is there any way that you think it might help visualizing the nerves outside of the spinal cord if they're injected or whatever? Or is it strictly bony structures that it helps you visualize?
No, the surgical anatomy of the spinal cord, and also I am doing. I don't know if it is a good
Example.
Okay, I think this is a good view. This is a model of resin, but this is made in molds of plastic molds, silicone molds. And we can have several pieces like this. The exact anatomy of the bone is in this piece because it's made in a 1:1 scale. So this is a real bone anatomy. And we can manipulate all the spine. I am doing also the lumbosacral segment, and we can see the anatomy of the bone, the real anatomy.
Okay. Okay, all you guys are spine guys.
We'll show you something here. Just a second.
Okay.
Just answer your question, so John. Actually, now it's easier to make a 3D model from bone. Okay, it's not that easy to see nerves in images. We would need MRI. So it's possible. We are really trying, me and Henrique, to enhance our 3D knowledge of segmentation and creating 3D images from exams, from MRI, from CTs. I really think we are, for example, the lumbar disc. We could create how can I say approximation of where the nerves are. I really think we can. So this would be a handy job. It would not be day-by-day surgery. And we are doing this in all our surgeries. So today, I really think we could do this for special cases, but for our day-by-day surgeries, it would take some time. It take slice by slice of the CT to draw where their nerves are. But okay, I really think it's possible. You know, I really think it's possible.
So we'll head that way. Francesca, you have a question? Francesca, you're on mute.
Yes,
Okay.
not anymore because it just has been answered.
Oh, he answered. Oh, okay. Okay,
Yes.
okay, Simon, do you have any questions or
Yes,
comments?
please. Thank you. Thank you very much for your presentation. I'm very interested in the holograms, specifically the segmentation preparation of the hologram. And you mentioned that you have some challenges, and you talked also about the brain. I'd like to know about the importance of superimposing the image, and whether that is something you'd like to move towards, and why is that difficult to superimpose the image over the field?
The most important and difficult is the tracking available for from the hardware. When you see the Vive dispositive, that's virtual reality headset, you see that there are 4 cameras around you. Those cameras are responsible for the tracking and show you where are you in the real world. When you use the Microsoft HoloLens, you have the tracking comes inside from the glass. For a surgery, this gives you you lose some of the precision of the position. So it's very difficult to do that.
I see.
You should need an external tracking device to help you to do that, the superimposing. And also, I think when you're doing a surgery and you have a hologram in your operating field, this can make you lose the vision of the surgical field. So I can't see details with a hologram superimposed over the anatomy.
I see.
This would be a case for minimal invasive spine surgeon or a percutaneous surgery where you don't see the anatomical extraction.
Excuse me, Enrique, excuse me, you're screen sharing your screen. Could you get off the screen share? You're showing
here.
Okay. Yeah, just get off the screen sharing. Click on that green arrow on the left. There you go. There you go. Okay.
Sorry.
There you go. Okay, you're all set. I'm sorry to interrupt.
It's because I wanted to show you the mesh quality that we do in the size of the holograms. Actually, now I can do a rendering from a full spine deformity. So I think even if you can't do a superimposing and doing a 3D guiding surgery, the possibility of having a surgical model in the operating room with the position where the implants will go and showing where you want to do an osteotomy can help you a lot. I can say it helped me to do the surgery without using so many radiation. I had used very low radiation from fluoroscopy and surgical.
Yeah, fluoroscopy used a lot of radiation, correct? Fluoroscopy is a lot.
Yeah.
And you mentioned in our last hangout with well, maybe a conversation, you said that you hardly use a fluoroscopy in cases of scoliosis.
I use, but
Not nearly as much.
Not really as much. With the glasses, I use it less. Okay.
Okay. Okay, now this may be a little repetitive, but I want to make sure that Victor understands what you guys are doing. Now, Victor, do you have any questions? Do you know what we're talking about when we're talking about augmented reality and spinal surgery? Victor, do you understand what we mean by that?
I like to show you one video.
Okay.
Let me.
Because Bruno and Henrique, Victor is a big spine guy. He's one of the premier anatomists of the spine in the world.
It's always nice to be introduced to those.
Yeah, I think you guys can work together, really. And you might be able to help Victor as far as anatomy of the spinal cord. He's writing a book now on spinal anatomy.
Oh, that's nice. That's
Awesome.
nice.
Yes, you guys have a lot in common.
John, I have to. I don't.
Yeah, one way is to put the video on and just screen share it. That's one way of playing the video.
Yeah. Okay.
Okay. Okay. Just pick on the right screen to share.
Okay. Okay.
Henrique, we're not trying to take the show from you. We're just. I want you guys to have a meeting of the minds.
Sure. That's awesome.
So, do you see this?
Yeah, we can see it. We can see it.
Yeah.
He injects the veins with latex. You inject the veins with latex, right, Victor?
Yes, these are the veins of the posterior aspect of the spinal cord.
Awesome.
Well, in the augmented reality, do you see the veins and vessels, or strictly bone?
No,
actually, sorry.
No, sorry. Go ahead, please.
Go ahead, Bruno.
Yes, actually, we can generally, if you have with contrast, you can have the arteries, and you can overlap the arteries into your model. But of course, not this kind of detail doctor is showing. We can see major arteries, major veins, but yes, it's possible. It's possible.
Okay.
It depends where you collect data. If you do a contrasted exam, you probably have visualization of the main venos and arteries, but not this kind of detail in microanatomy.
Yeah.
Okay. Okay, Victor.
Yes. This is another. This is the Adamkiewicz artery.
Mm-hmm.
This is the great anterior spinal artery.
Oh. If you contrast that to use a CT scan, we can do a model of that for you.
You can see the course of the injection inside this beautiful artery.
Okay.
Okay.
Okay, excuse me, Victor. We can go over this after the talk, we can talk about it. But let's finish up the topic of augmented reality and the spinal surgery. Okay, Victor? And we certainly can talk after. All right? Hello, Victor? Hello?
Yes.
Yeah, I do want you guys to get together. I do want you guys to get together and talk about your anatomy.
And for example, this is also beautiful, beautiful, beautiful injection. Look at this.
Okay. Well, have you guys seen anything like this before?
Not.
No?
Good. This is beautiful. This is very beautiful.
Yeah. Victor spends a lot of time injecting, and the specimens have to be fresh, right, Victor? You can't use old specimens, I believe. I think he said that once.
There are so many variations in the anatomy of the veins and also the arteries. Right now, I am trying to write a paper with one guy from Boston about the arteries. Yeah, John Bennett, excuse me.
Yeah, Victor, can you let me introduce another Brazilian neurosurgeon that just joined us. Bernardo, it's good to see you.
Hello, Bernardo.
Hello, everybody.
Hello, Bernardo.
Long time no see.
Hello.
Remember Simon, right?
Hi, nice to see you.
This is Bernardo de Andrada. He's a great neurosurgeon from Rio de Janeiro. He just got out of the OR. And,
thank you, John Bennett, for the words.
Yeah.
Nice to meet you.
Okay, there's Bruno to your right. He's an orthopedic spine man from southern Brazil. I think he's from your area of the country.
Nice to meet you.
Bernardo's also from southern Florianopolis, correct, Bernardo?
Yeah, my wife is from Florianopolis. I'm from Rio de Janeiro.
Okay, yeah, Bruno's from that neck of the woods.
We are from Jaraguá do Sul. Actually, it's very close to Florianopolis.
Is it Santa Catarina state?
Yes.
Oh,
Me and
nice.
Dr. Henrique.
Yeah, and this is
nice to meet you.
And this is Francesca, a medical student from Romania, to her right.
Oh, nice to meet you, Francesca.
And Bernardo and Henrique Lambert, MD, who gave a talk on the augmented reality. He's also from southern Brazil.
Oh, nice to meet you.
Enrique and
Hello, Henrique.
Marco is a Bolivian medical student. Hello, Marco.
Hello, Marco.
Well, I guess he's muted. Okay, you know Simon, old Simon.
Yeah,
He's still hanging in there. And Victor,
Hello.
I'd like to have you meet Bernardo de Andrada, a neurosurgeon from Rio de Janeiro. He's a spine man.
Oh, hello, Victor.
Hello. How are you? Nice to meet you.
Yeah, Victor's a
Nice to meet
foremost.
you too.
He's a foremost neuroanatomist from Mexico City.
Oh, nice.
Yeah, so all you spine guys here in one spot. This is great. This is great. Okay, yeah, we were just going over Bernardo using augmented reality in spine surgery. Do you have any general questions for Henrique? I know you're interested in new things in new surgery and neurosurgery. Is there anything you want to ask him about augmented reality in spinal surgery?
Oh, actually, the lecture is already done.
Yeah. But you can ask him
Sorry.
general questions.
Yeah, if you can do a brief explanation, I would
Victor.
take.
Yeah, it would be good for Victor.
I
It'd
will.
be good for
I will
Victor
share
too,
my screen.
because okay, it'd be good for Victor too, because I invited Victor late.
Oh yes, sorry.
That's all right. Like we can go over it again.
Are you seeing my screen?
Yes.
So here I have our CT scan 3D model rendered from a patient. We have a posterior surgical planning here for the compression and fixation of cervical spine. Well, what we do is we render this at the surgical field. So I will show some videos here. They're showing what we do at the surgery. We use those models for reference in spine surgery. Here is a lumbar scoliosis, where you're looking at the trajectory of the pedicle screws. You can also see exams at the OR. Let me show.
Oh, nice.
This is MRI from a patient looking at the OR. So you don't need to use your hands to see the exams, and
Yes.
it's also a nice video recording and you can also broadcast surgery. So this is a very nice camera. You have an excellent detail. I had never seen another camera doing this kind of record. So if you look, it's very good recording with the HoloLens camera.
You're actually recording it from the HoloLens, correct?
Yeah, this is from my head, from the HoloLens here.
And the quality of the camera is excellent.
Is excellent, right?
And you do it using a glass, yes?
Yeah, this is the HoloLens. I will show you here.
Oh,
It's
this glass.
kind of like that, right? That's
very nice.
John, I think I'm gonna put the HoloLens to show something.
Yeah. Okay. Here. Sure.
Just a second. Are you seeing my screen?
Yes. Yeah, we can see the computer. So that's the seat you have. That's the view you have from your computer.
Yeah, that's the view of the glass actually.
Okay, you actually have the lens on now.
Yeah, I'm using it. So here is a live demonstration of what you can have at the surgery room. So here you have all the posterior arc for implant for positioning implants at the spine. You can actually move around, take a look. Here is a surgical planning for flat back deformity correction and the spinal stenosis canal.
Let me ask you something. Model exactly from the patients that you are performing the surgery?
Yes, this is from a CT scan. This is rendered from a CT scan.
Oh, very nice.
So
it works similar to navigation.
We can't do navigation actually at the moment. We do a reference procedure. So I look at the anatomy of the patients and then I transpose this for the surgery field. So here you can take a look at the pedicle trajectory also. So you have an X-ray, a fluoroscopy view. Can you see here? at this model.
Yes.
You can see the pedicle trajectory here. This is an example here. So for a deformity surgery, this is very helpful. The main problems are how people see use the glasses. So not everyone can use this glass and without having headache or having a closer interaction with the holograms. But here, let me show.
One question I had, Bernardo, was that can you actually see the surgical field wearing those glasses? But Henrique says you can look down and you have a really good view. Correct, Henrique?
Yes, yes. Actually, the HoloLens doesn't
obstruct the visual surgical field.
Doesn't difficult. No. Actually, when I'm looking at for the surgery, I look below my hands, so I'm not seeing through the lenses, you know. But if you see my hand here, if I try to superimpose a hologram at the surgical field, you see I can't see my finger well behind the hologram. So that's the problem with the superimposing holograms.
Okay. Yeah, what Simon mentioned.
So you have to look. Yeah, you have to look down your hand, down the hand.
Okay.
Can you have some magnification with this glass or not?
Magnification of the hologram.
Yes.
Of the hologram? Yeah, sure. Let me show you.
No, of the view of the surgery. No, I think no.
Like using a microscope.
Scope. Yes, no.
I
because the problem that is
microscope you can't, because it's inside the glass, you know. So you will not see the hologram at the surgical field, but you could use the look through the microscope and as a reference, but not was just looking around, you know.
Yes. Very nice.
So let me just show you something here.
Yeah, can you magnify the hologram too?
Yeah, I can change the...
If you had an area of pathology you wanted to look at really closely, you could blow it up.
Yeah.
Yes, you can blow. And just answering Bernardo, if you could have a microscope or a camera recording, and you could broadcast that view to your glass. So the glass is not magnifying, but you could broadcast it, so you will be able to see almost like where you are looking from a camera. Okay, it would be, I think, very, very easy to do it if you have the correct camera for filming. Yeah, I think it's possible and kind of easy. Yes, Henrique, to do this.
Yeah. So here I have some other, I can scale, can move, and let me scale here. I can change the size. Actually, I can look inside the hologram, but I think it will not a good view right now.
Oh, let me.
Okay, I see how you've magnified it. Yeah, okay.
So here you can see, I can have a better visualization of the model.
Okay.
It's the same model, actually. Any other question?
Yes. Do you need some specifically software to do this, or no?
We actually do some programming. You need to use like 4 or 5 softwares to get a rendered mesh at the HoloLens. So because it's on development yet, the glass.
You know, this is not easy to learn, correct? It took you guys a while to learn how to move the images, etc.
Yeah, like a year.
A year. Wow.
Yeah. Like you're having now a live broadcast of what I am seeing. So this also is very good for surgery recording.
Yes, there is some lag, Henrique, but of course we are broadcasting live. And just answering Jones and Bernardo, today I think we can in one hour we can have everything done for surgery. Yes, Henrique, from collecting the CTs, from doing everything, not the surgery itself, but for having the model ready, I think in 1 hour, and planning the surgery, I think it takes sometimes a little bit more. To get to the HoloLens, Henrique uses another software, which is Unity. But I think Henrique, what's your opinion about that?
At the moment, I take about 3 hours to do a surgical plan, surgical planning, and actually the surgical planning is the key for all of this. You do a surgical planning, and after that you can print that, you can use as a hologram, and actually there are people doing this in the world and charging for it. So you do a 3D printed model. The price of the model is cheap, but what you pay is for the segmentation, for the work of that they have to turn the CT scan into a model. Actually, what we use here is we use the same model that is printed, but with another visualization, another kind of visualization. It has the advantage of taking less time. You don't need to print. If I couldn't print a model of that before 36 hours, like Bruno did, Bruno printed that model in 36 hours. I can use that right after I did the surgical plan. And this advantage is that I can touch the model. Bruno has a 3D printed model. He can touch. He can manipulate with his hand. Here I can't do this, but I can have this model earlier than him. So it's the same. It's a different way to show what we planned for surgery. Just the output.
Mm-hmm. Do you foresee a day when you'll get basically a format where you just plug in the MRI of a patient into it and cut down the time? Do you know what I mean? You already have the format made and you just put the person's scan in?
That's very dependent of scripting. You
Scripting,
would need
right.
hard research into body anatomy, so that the computer could learn how to segment the structures. You need to say to the computer, this is the bone, this is the vein, this is the artery, and the computer needs to learn how to see that and extract from the CT scan, from the MRI.
Yeah.
So this is how developers do a library. You're going to teach the computer how to look for these structures.
Okay.
As people say in machine learning, seeing is not one thing is seeing, and another thing is to know what you're seeing. Mm-hmm. You need to teach the computer how to what he's seeing, so he can process that image.
Mm-hmm.
And that's a lot of work.
Well, yeah. Well, with the progress in artificial intelligence,
John,
go ahead, Victor.
I want to show you another video. This
Sure,
is
sure.
really look at this. Okay. Okay. Let me put this in. So, are you seeing? Yeah. Do you see?
Yeah, look at Bernardo's wide-eyed.
Okay. This is the lumbosacral segment of the spinal cord. This is the arachnoid. I am dissecting the arachnoid to see the medullary conus and also these veins. These are some nerves of the caudecina, and if we separate these nerves, we can see the posterior, the beginning of the posterior spinal cord. This is the caudecina. The filum terminalis is in there. That is the this video is finished. So I agree with all of you. For a surgery of the spine, it's very important to know all the anatomy, not only the bone, not only arteries, also the spinal cord. For me, is the vascular anatomy is really beautiful.
Okay, very good. Okay, we can stick around, but let's just wrap this up so we can send the video out to people that are interested in augmented reality in spinal surgery. I'd like to thank everyone for coming out, especially you, Enrique. And we hope to continue. We hope to continue to bring what you guys are doing down there in southern Brazil to the world. Hopefully we'll use this platform to introduce you to people like Victor and Bernardo and the medical students, and we look forward to doing that. So please stick around. I'm just going to end this formally. Thank you very much.
Thank you for